Monitoring athletes' responses to training and other life stresses is important for implementing favourable training routines and achieving optimal performances. The purpose of this video is to provide an overview and an evaluation of some of the current psychological tools used in training contexts amongst athletes. In particular, there is a multitude of different instruments and questionnaires that are covered in literature. And for today's video, we're actually going to cover 4 of them. And you can always refer back to literature for more specific questionnaires and recovery scales. Each measure has been shown to deliver valuable information for athletes and coaches regarding individual responses to training. These responses are measured by observing changes in mood, emotions, perceived stress and recovery, and sleep quality. Practitioners need to consider the appropriateness of each psychological tool in the context of their particular group of athletes they work with. Regardless of which methods are employed, care should be taken to employ measurement in a systematic manner, provide timely feedback, and consider frequency as to not burden athletes too much. While psychological measures are an important part of avoiding maladaptive training responses, performance and psychological changes also need to be taken into account. A harmonious interplay between high training loads and appropriate recovery strategies represents a key element for elite athletes to perform optimally. Moreover, maintaining this balance plays an important role for the overall well-being of an athlete. Incorporating an adequate training plan is a complex process influenced by many factors that are often unique to an individual athlete and the respective sport. Therefore, to ensure that a particular training plan is both optimal for both performance and athlete well-being, athletes' responses to the training process should be monitored. There is growing consensus that the relationship between overall load, athlete health, and performance can be viewed as a continuum. Here, underperformance is caused by either insufficient training loads or as a result of critically excessive training. When periodization is implemented adequately, a period of intensified training is succeeded by sufficient recovery. This pattern results in enhanced sports performance, also known as supercompensation effect, which is a favorable outcome along the continuum. Part and parcel of supercompensation is a state of fatigue and reduced performance, followed by an individually adjusted taper phase, allowing for physiological and psychological recovery. Unfavorable responses occur when excessive training leads to a decrease of athletic performance, with problems also emerging regarding the well-being of the athlete. This superfluous training places an athlete further along the continuum at either non-functional overreaching or overtraining syndrome, dependent on the severity and duration of the imbalance. Non-functional overreaching describes extended decrease or stagnation in performance lasting several weeks or months, and overtraining syndrome lasts from months to years. Several responses are reported which have been suggested to manifest dependent on whether an athlete falls along this continuum. Following intensive training periods, adaptive outcomes can include the presence of short-term, lasting days, not weeks, fatigue, and depressed immune cell function. Non-functional overreaching and overtraining syndrome are accompanied by altered hormonal regulation, depressed immune function, and negative psychological symptoms. These psychological alterations may emerge as mood disturbances, reduced well-being, poor sleep quality, irritability, or boredom. Of these, reduced well-being and sleep quality is the most prominent variables affected by excessive training. Only long-term rest together with a significantly reduced training load may lead to the re-establishment of the physiological and psychological balance of overtrained athletes. Notably, this balance is influenced by the amount of overall stresses, training, specific and general, combined with recovery. Thus, factors beyond external training loads, such as stressful life events, are involved in the possible over-accumulation of stresses in relation to an individual's recovery. For example, adjusting training loads may be appropriate if an athlete is experiencing greater distress as a result of a stressful life event. And this higher level of psychological stress may increase an athlete's injury risk. Therefore, measurement tools for objective and subjective responses should be implemented to provide a holistic overview. Objective responses can be monitored by observing different physiological indicators and biochemical markers. These include monitoring heart rate variability or examining the prevalence of hormonal and metabolic markers. While these measures offer valuable information, no single physiological marker can predict performance outcomes. Subjective training responses are predominantly gathered through self-report measures. These instruments can be characterized based on the scope of the area they are focusing on. Namely, they may examine mood states, perceived stress and recovery, physical and behavioral symptoms, or a combination of these aspects. Research has found psychological reactions to changes in training loads to be more sensitive than physiological markers. Moreover, these findings are more consistent across studies amongst athletic populations, and they appear to occur prior to biochemical and hormonal changes. Furthermore, the measurement of many physiological markers requires laboratory testing, which can be both impractical and expensive for examinations in practice. In contrast, questionnaires can be easily and cost-effectively administered to large groups without impeding training. The primary aim of this video is to present a review of specific self-report measures used for monitoring the subjective aspects of training responses. More specifically, the objective is to offer insights regarding the purpose, structure, strengths, and general considerations for applied use. For this video, we will review 4 different psychological monitoring tools. They are 1. Profile of mood states, or POMS. 2. Emotional Recovery Questionnaire. 3. Total Quality Recovery, the TQR. And lastly, the Recovery Stress Questionnaire for athletes, the RestQ Sport Questionnaire. Other monitoring tools such as the daily analysis of life demands, the acute recovery and stress scale, short recovery and stress scale, and the multi-component training distress scale have been used and reviewed in detail. If you're interested in these tools, take the time to search and look them up. With respect to the 4 monitoring tools that we'll cover today, we will discuss them in terms of purpose, structure, research findings, and limitations. The purpose of the POMS scale is to present insights into a person's mood state. It is a 65-item questionnaire yielding measures of 5 negative affect scales, namely tension, depression, anger, fatigue, and confusion, and 1 positive affect scale of vigor. The global score can be calculated by subtracting the vigor score from the sum of the scores from the 5 remaining scales. It's typically administered with instructions to respond on the basis of feelings experienced in a specific time frame. For example, the time frame refers to one of 4 instructional sets where participants are asked, how have you been feeling during the past week, including today, generally, today, or right now. The POMS was developed through 6 studies and showed evidence of predictive and concurrent validity and internal consistency. In terms of monitoring training responses, and particularly when research aims at identifying possible symptoms of overtraining syndrome, the POMS is one of the best studied measures. The measures appear to detect psychological changes of single training sessions and recovery periods as short as 1 day and night. A multitude of studies have portrayed a pattern of increased mood disturbance with increased training loads, combined with subsequent decreases in mood disturbances during a recovery phase. In response to intensive training, swimmers have been found to consistently report increased negative mood states and decreases in vigor during periods of rigorous training. During a 4-week study, the POMS identified collegiate swimmers suffering from training maladaptation with an average accuracy of 81.45%. The POMS energy index was derived from the POMS, with the objective to more efficiently monitor training responses. An energy index score is obtained by subtracting the POMS fatigue scores from vigor, as these scales have been shown to portray reactions to training responses effectively. Research employing the ratio vigor to fatigue scores found correlations between this ratio and changes in neuroendocrine hormones amongst athletes following a triathlon. In another study amongst 11 elite kayakers, the POMS and energy index scores were responsive to both training stress and recovery during an intensive training camp, with higher disturbances following training and lower values after a taper. Another measure derived from the POMS with a distinct purpose of detecting maladaptive training responses is a total distress scale. This short scale consists of only 7 POM items, of which 5 are related to depression and 2 are related to anger, and was developed from discriminate function analysis of POMS data of 170 collegiate swimmers. The total distress scale was more accurate in identifying overtraining in athletes compared to predictions using the POMS total mood disturbances scores or depression scores. The most evident strength of the POMS is that it has been used widely in research for several decades. One byproduct of this popularity is that validated adaptations are available in many languages, including Chinese, Hebrew, Dutch, Korean, French, German, and Japanese. This provides the opportunity for cross-cultural comparisons and the use of the POMS within multicultural teams. In contrast, the POMS has received criticism as it was developed for the clinical settings and not with the athlete population in mind. With 65 items, the original version is too extensive and long for regular use. And the single positive mood state, with all the different modifications of the POMS, does not assess the full range of positive emotions that represent different functions in the recovery process. The Emotional Recovery Questionnaire was developed to better evaluate the emotional recovery status of athletes and thus fill a gap in research, as positive emotions have received disproportionately less attention. The questionnaire aims at monitoring emotional changes over a brief period of time. Findings from research has reasoned the importance of monitoring positive emotional states, as their presence has been shown to aid in the recovery process. Moreover, the presence of negative mood or emotional states does not equate to a lack of positive emotions. Ensuring the presence of positive emotional states is useful towards assessing an athlete's ability to realize specific recovery needs. The Emotional Recovery Questionnaire comprises 22 items assessing the 5 emotional states of happiness, security, harmony, love, and vitality. A 5-point Likert scale ranging from 0, not at all, to 4, extremely, is used to indicate the emotions felt at the time of assessment. The developers recommend that the Emotional Recovery Questionnaire should be applied as a supplemental tool to measures such as the POMS, as it considers the positive emotions related to recovery. This combination contributes to a more holistic overview of the athlete's mood and emotional states. Subsequent to the development process, a qualitative item analysis was performed with Swedish Olympic athletes. The analysis showed that the Emotional Recovery Questionnaire scores followed a similar pattern to recovery scores as measured by the Total Quality Recovery Framework, which we will review next. This finding was seen as a confirmation to apply the items at the elite athlete level, supporting its use for monitoring recovery in the applied setting of sport. In one case study, an ultra runner was monitored during the course of a race. The results revealed that the positive emotions correlated positively with perceived exertion. This was confirmed by a negative correlation with exertion and the POMS score, which led to the authors to conclude that the participant enjoyed the exertion of running. These findings underpin the need to further examine positive emotional responses to training in order to better understand their role in the facilitation of recovery. They also support the complexities of psychological responses to training, as negative mood states and positive emotions were simultaneously present. While the Emotional Recovery Questionnaire is listed as a monitoring tool in the literature, not many studies have implemented this tool due to the limited applicability of a single case study and the questionnaire development publication. More research is recommended to delineate the sensitivity of the Emotional Recovery Questionnaire to alterations in training practices. This research gap limits the current applicability of the Emotional Recovery Questionnaire. However, the measures bear practical relevance as it reminds practitioners to examine the positive aspects of athlete responses. Some athletes may respond to more favorable training as a result of high levels of positive emotional states, despite a profile of negative responses. Further, the scale can be applied in practice beyond the realm of monitoring training responses. In team environments, the presence of positive emotions can be important to support social team cohesion. The Total Quality Recovery Framework was developed with the purpose of preventing the onset of overtraining syndrome and to maintain equilibrium between recovery and training. The Total Quality Recovery process includes two parts to observe recovery actions and global perceptions of recovery on a daily basis, with an emphasis on psychophysiological recovery. Essentially, the two parts ask the athletes, one, how does it feel? And secondly, what have you done? Referring to daily activities and recovery perceptions. The Total Quality Recovery aims at the differentiation between cause and consequence of stress and considers both the source and magnitude of the stresses as reflected in recovery. There is a further focus on matched recovery, ensuring that the physical stress is treated with physical recovery methods and that psychological stress is matched with somatic recovery methods. For example, social support to help with stressful life events. Athletes using Total Quality Recovery complete the two scales known as the TQR Perceived Scale and the TQR Action Scale. The Perceived Scale is an adapted 15-point Borg's rating of perceived exertion scale, where the anchor values are tied to perceptions of recovery. The scale ranges from 6, no recovery at all, to 20, maximal recovery. For reference, the equivalent RPE scale ranges from 6, no exertion, to 20, maximal exertion. For the TQR Action Scale, athletes collect points over a 24-hour period. 20 points are available, with a score of 20 being considered as optimal for recovery. In contrast, a score of 13 is the minimum cutoff limit, and any score below this indicates incomplete recovery or under recovery. The recovery action points are compiled from 4 areas: nutrition, 10 points, sleep and rest, 4 points, relaxation and emotional support, 3 points, and stretching and cool down, 3 points. While the Total Recovery Action Scale emphasizes recovery activities rather than providing insights regarding particular training responses, it is a useful complementary measure since incongruence between the two scales can indicate maladaptive training responses. Ideally, athletes complete the TQR scales daily in combination with the RPE. This should be carried out as the RPE supplements Total Quality Recovery scores by observing an element of perceived stress. In research, the Total Quality Recovery has been considered a valid strategy for monitoring the effects of training loads. In a study, 6 surf lifesavers completed the Total Quality Recovery scales daily for 2 months. The participants became more aware of the influence of specific recovery actions on perceived recovery and performance. It was reported that the Total Quality Recovery Action Score led to increases in overall recovery behaviors, which was reflected in an increase of Total Quality Recovery perceived scores between weeks 1 and 8. It was concluded that the TQR scales exposed individual differences in responses to training and recovery actions. In another study, it was concluded that the TQR scales exposed individual differences in responses to training and recovery actions with basketball players during the course of the regular season. Finally, a few studies have focused solely on the Total Quality Recovery perceived scale. Amongst elite soccer players and volleyball players, perceived scores showed an inverse relationship to muscle damage as measured by blood creatine kinase. There are several benefits of implementing the Total Quality Recovery model. First, it supports the daily habit of considering recovery behaviors. Also, using the Total Quality Recovery perceived score in isolation is an economical, reliable, and valid measure of an athlete's recovery status. Keeping track of both perceptions and actions can help rule out different causes if maladaptation to training is detected. For example, total quality recovery action scores can indicate if poor training responses can be attributed to poor nutrition or sleep. One limitation for the total quality recovery model is the recommended daily monitoring, which demands a well-established monitoring culture. This may not correspond to the resources of many teams and athletes. Complementing such a protocol may lower compliance by athletes as it places an added time burden on athletes and the support staff. However, there is support for less frequent implementation, as portrayed by the aforementioned studies. The implementation of an online system or a smartphone application may ease the data collection and feedback processes and reduce paper clutter. Only using the RPE as a measure of stress is another limitation. The RPE, rate of perceived exertion, is a single-dimensional scale and is much better suited for measuring the training load rather than athletes' training response. Therefore, the use of other measures that provide a more multidimensional overview of perceived stress is recommended. Kelman and Kalus developed the Recovery Stress Questionnaire for athletes, or known as RestQ Sport, as a multi-dimensional measure of perceived stress and recovery. This approach enables the assessment of both the stressing agents and the recovery strategies being used by athletes. In this self-report instrument, athletes evaluate physical, subjective, behavioral, and social aspects of stress and recovery. It is composed of 76 questions introducing a series of statements that address both non-specific and sport-specific aspects of stress and recovery. Responses are given on a Likert scale from 0, never, to 6, always, indicating the frequency of various activities during the past 3 days and nights. This is the most common time frame. Other options involve responding in reference to the past 7 or 14 days and nights. Assessment is completed by compiling the scores into 19 scales, 4 items each, of which 10 are for stress and 9 are for recovery. It should be noted that the relationship between the recovery and stress scores is not symmetrical, and thus they should not be combined. The results can be represented graphically as a recovery stress state profile. Convergent and discriminant validity has been established through comparisons to the POMS, the multidimensional physical symptoms list, and the state trait anxiety inventory. In addition, a short version, the RestQ Sport 36, is also available for athlete monitoring. This revised version is comprised of 12 of the original 19 scales, with 3 items for each scale. The short version serves as an economical measure to be used at the group level in an applied setting. The RestQ Sport has been reported as one of the few questionnaires addressing the complexities of both stress and recovery. It has been used to evaluate the effects of rapidly increasing training volumes on the recovery stress state. The recovery stress state has also been associated with performance and biochemical markers. More specifically, the scales fatigue, injury, physical complaints, and physical recovery were sensitive to intensified training loads during the pre-competitive period in volleyball athletes. Furthermore, scores in the scales of fatigue and being in shape were significantly altered during phases of functional overreaching. One study with elite swimmers found a linear dose-response relationship between training load and recovery stress states measured with the 36-item scale. In summary, the RestQ Sport could be used to guide intervention strategies according to individual player responses, as it provides comprehensive insights about possible sources of stress and lapses in recovery. Further, it may be considered as a practical tool for recognizing states of under-recovery and overtraining syndrome in its early stages. Like the POMS, the RestQ Sport has been validated in several languages, including German, Dutch, French, Swedish, and Spanish. However, the 76-item version of the instrument has been implicated as being too time-consuming for frequent use. And the 36-item version has received limited research attention since it was published in the early 2016. This list is by no means exhaustive, with attention in the research being given to other psychological monitoring tools, such as the daily analysis of life demands for athletes, the acute recovery and stress scale, the short recovery and stress scale, and the multi-component training distress scale. In conclusion, psychological monitoring is an indispensable facet of athletic training, offering critical insights for tailoring individualized training programs. By understanding and applying the discussed tools, coaches and practitioners can significantly enhance athletes' performance and safeguard their mental well-being.